Good morning, everybody.
Morning.
The Human Services Board meeting to order. And so do we have a motion to accept the minutes of September 22nd? Thank you. Okay, thank you. Thank you. All in favor? Okay, so we're going to go on to department requests. Ready?
Sure. I'll start off. Okay, good morning, everyone. Just some highlights from the peer-to-peer. We've been quite busy doing all sorts of good things throughout the county. Just a quick rundown. We've increased participation for our Washington County events significantly. We just had our Argyle breakfast a couple of weeks ago. We had over 50 participants at the breakfast that morning. Outstanding. Really, everyone's enjoying it, and it's another medium for us to explain to some things, upcoming events, hand out calendars, kind of triage our veterans to see how we can help them. Really outstanding karaoke out there at the auction barn has been awesome. We've also at Rumbelly's, our monthly dinner, we had over 40 participants last month. So we're continuing to look forward to growing. We might have to push their pool day out of the way in order to accommodate all of us, which is a good problem to have. And we're seeing quite a few businesses throughout the area that want to start hosting events for us because we've had such a positive turnout. Very good stuff going on. We're establishing, probably not in November, but looking like December, 2 monthly volunteer days for our veterans and family members, where we go to different establishments throughout Warren and Washington County, and our veterans have an opportunity to volunteer their time. The Open Door Mission has volunteered to allow us to go in and work in their kitchen one day. We're looking for a spot out in Washington County where we can donate our time. Again, at least once a month, looking for 2, if we can fit it in the calendar. We've established a memorandum of understanding with St. Anne's. They've given us a very generous price for two sessions a month for our MST support group. We're very excited. We're hoping this becomes a pilot for the rest of the state. My good friend Joe Tamburino has been on the ground working that angle. He's been awesome. The first proposal they sent back to us was far too expensive, but we're able to service 8 veterans twice a month with St. Anne's, with licensed clinicians to help give them the tools in their toolbox for their struggling with MST. We've also established a connection with Crusader Outdoors, a veteran-run organization that they run events, outdoor events, hunting events, fishing, all sorts of good things for our veterans. So we're establishing a connection with them. Our first hunt is in a couple of weeks. We're sending a couple veterans out there, so I really think it's going to be a good time. We had our hunter safety course held on SUNY Adirondack. We had 30 participants, quite a few from Washington County that participated. So Mary Beth Mitchum came in and they did our training course. It was awesome, really a good time. And met with Ben D just recently, who I had the opportunity to speak with. We're really trying to get into the jails. So he had expressed that there was some reluctance on the part of some folks in the leadership positions. But really, in the end, we're trying to take care of our veterans, make sure that they're prepared upon discharge, that they have all their paperwork that they need, their TD-214s, their birth certificates, all that stuff, and then begin the training process as soon as they're doing their intake. That way, upon release, again, we're trying to reduce recidivism. That's ultimately the goal. So Ben Deeb and I have worked closely. We're collaborating back and forth. And I should just received a call from Warren County Jail to help out process a female veteran. I'm going to be meeting with her tomorrow. So that's all I've got. If anybody's got any questions, please feel free.
Anybody have any questions for me? No. Thank you very much for commenting.
Oh, it's going very well. Please reach out to the veterans again. We're literally going door to door because of our difficulty reaching out. Some folks don't have emails, some folks don't have Facebook. Those are the easiest ways to communicate with folks. But if you just give them a flyer, give them my number. I don't care. Really, we're working right now with the Office of Mental Health to get ourselves a vehicle, so we won't have any more transportation issues, because we know out there that there's folks that don't have a license. If they have a license, they don't have a car. It's another thing that we're trying to look into. Receive some phone calls about veterans who have difficulty with their vehicles. Trying to work with some local garages to see if we can get some donations from different agencies. And then some of these mechanics said that they would be willing to donate their time. So I know that car troubles are a real pain on so many levels. So that's on the horizon. It's not quite there yet. Hoping it transpires quickly, because I know that as we head into the winter months, it's going to get more and more difficult to get around. We did have the meeting with CDTA. I thought they had some restrictions on the fares for veterans, and I expressed the issue, and we'll see if anything changes. They had said that veterans with an honorable discharge get a reduced rate, but the reality is veterans with honorable discharges usually are in a better socioeconomic spot than those who have an OTH or general under honorable. So I said that might be a barrier, and perhaps they should reconsider, but again, they'll do what they want. So if anybody has any contact with any veterans that needs assistance, please let me know.
Thank you very much.
Thank you. Yes.
Question. Were you going to talk about the VSO accreditation, successful initial accreditation? Was that on you? Was that?
Nope, that's not me. Did I miss something?
No,
Okay.
I was just trying to, Ken just called, he's not going to be able to make it. He's done it the last couple of days, protecting the family, so.
Oh, no.
Okay.
And well, one more thing, for the Crusader Outdoors, we are looking for a Purple Heart veteran to fill one spot. We had one drop out for a hunt in a couple of weeks. It's an all expense paid. There really doesn't need to be anything. And as a matter of fact, if there's certain needs that need to be met to help this veteran get out there, we can work to get them in place. But these guys that are run Crusaders Outdoors, they're veteran run. They're really all about taking care of our veterans, getting them outside. It's been a pleasure working with them. So if anybody knows of a Purple Heart veteran that would be willing to go on a hunt in a couple of weeks, just email me or call me and we'll hear the details. I've reached out to my email list. Haven't had too many hits yet. So if anybody knows anyone, just let me know. All right. Thank you, everyone. Have a good day.
Thank you so much. Sam, did you want to follow up kind of tip, or do we want to just wait?
No, he said it would be initial accreditation. I believe that was for Megan. I believe she probably got her accreditation. She bears that. She's got another at that. And they have 3 accredited up.
Have a good day, everyone. Thank you.
Hi, Jerry. Thank you. Okay, we're on the youth bureau.
Morning. So we would like to recognize, get permission to recognize the YRE Connects funds from Cornell University. We have previously asked permission to apply for the grant. The original grant, YRE Connect, stands for Youth for Entering the Community Through Opportunity, Networking, Navigation, Education, Collaboration, and Transitional Support. We were not involved with naming. Oh, that's not. So it is a community of practice grant that was originally from the New York Council on Developmental Disabilities through Cornell University. That went to Warren County Probation, and then Warren County Probation wanted us to collaborate with this process, and then us becoming a mentee team. So as such, we can get a total dollar amount of $8,500. We've already been participating in all of the training sessions that Cornell University, along with Warren County team, has been participating in. The target population for the grant is youth between the ages of 14 to 24 with disabilities, and very open interpretation of anybody with a disability we could work with. our particular goal is to focus on the youth between 18 and 24 with disabilities that are incarcerated in either jail or prison, because we really don't do a lot of work with those that are re-entering into the community from prison. So we'll just be reaching out to the parole officers, identifying youth who fall into this category and making sure they have the services that they need. Our idea originally, this was really several months before Mike left. It was initially presented, and we were going to contract with Big Brothers Big Sisters for a total dollar amount of $4,600 to offer group outings for youth between the ages of 14 and 24 with disabilities. So that was one piece. And then we were going to focus on the youth who were being released from jail or prison, and we were keeping in-house for $3,900 total dollar amount, which equates to about 123 hours of service. We anticipate the grant ends March 31st, so we're at the tail end of the entire grant. So we anticipate that we'll be recouping those dollars ASAP and contracting with Big Brothers Big Sisters. So we need permission to recognize the funding.
So moved. Thank you.
I'll second it for discussion.
And anybody have any questions? Andrew?
You said this is salary, correct?
So
I heard you mention that.
So we kind of equate how many hours that amount of money would equate to. Hours that we would be participating and doing something along the lines for this grant.
Well, my
specifically.
question, I guess, is this offset? Point ones,
Yes,
okay.
yes.
Any other questions?
It's the resolution of finance.
So we're moving this to finance. Okay. All in favor?
Aye.
I think that's all I need. Thank you. Thank you very much. Yeah. Okay.
We have on our agenda is to recognize the child passenger safety grant. It's in the amount of $13,200. And that grant period goes from October 1st through September 30th. And that is to purchase car seats and do child passenger safety clinics and things like that within the community. So we're just looking for permission to accept that grant money.
Dan, motion and Tim and Brian and Dave, all in favor?
Aye. Also resolution.
Resolution finance. Thank you.
I had mentioned, it was last month when we did the month before that we were having a insurance company come in and do a quality assessment over at Public Health. We have to re-credential with insurance companies every few years. Normally they accept our New York State Department of Health review as part of the re-credentialing process. But it's been over 36 months since the Department of Health has been into our agency to do a review, so they had to come and do their own review. So they were here, I believe it was September 9th, and it was Empire Blue Cross, but they went through a company called Ovation Healthcare. The gentleman came and spent a few hours with us. They did have several recommendations. And again, this is not New York State Department of Health audit, so this is just, these are strictly just recommendations. They had 3 recommendations. First of all, I wanted to let you know we scored a 95 out of 100, so we were happy with that. The 3 things that they recommended is for us to develop a policy to improve staff safety and decrease potential liability concerns. So for instance, this was for our licensed home care service agency. So they gave an example of a nurse is out at home. You know, what is the situation where they would leave the home because of safety concerns? So I did speak with safety officer yesterday about that, and we're going to work on a policy together. You know, to come up with, you know, it's hard to deal with every situation, but at least just to outline, you know, how they would handle that. The next issue or recommendation that they had was to modify intake assessment to screen safety and potential abuse. Our nurses are mandated reporters, so if they were to see something in the home, they would be reporting that. But we don't have a particular policy or form or question that we ask within the home when we're there. So we'll be working on that as well as far as our intake assessment. And then the last thing that they had recommended was to modify our intake assessment form to screen all patients for fall risk. When we had the certified home health agency, we did do that. But now that it's not part of our regulation that we have to assess for fall risk. The population that we're seeing are babies, and, new moms. So we will look into that and try to develop a policy, so we can assess for fall risk. So those were the 3 recommendations that they had. Again, we didn't have to issue a corrective action plan or anything like that. But those were just the recommendations that they had. So I just want to make sure you were all aware of that.
Not that I'm opposed to any of those things, will happen.
Nothing. They're not gonna come back and reassess or anything like that. Those were just their recommendations. So. Right. Thank you. And then the next thing on our agenda, the compliance program policy. The New York State Office of Medicaid Inspector General revised their regulation regarding what has to be in our compliance plan. We are required to have a compliance plan policy because we do bill Medicaid and receive Medicaid funds. So we've been working on a policy. Brad had put it together and just looking to move forward with that policy and procedure. There are some changes within it. So we did have to have a compliance officer within our department, which we have had in the past. So in this policy, I am in there as the compliance officer with Fran being the backup. Another part of this policy that is new is we also have to have a compliance committee that has to meet on a quarterly, we're going to do it on a quarterly basis. So right now we have a professional advisory committee that does meet on a quarterly basis. It does involve our medical director, staff within our office, and then some outside representatives as well. So we have named them as our compliance committee. And then if there were issues there, we would bring them back to this committee to make sure that you were all aware. Also in the policy, it does state that if I was to receive a complaint from the outside, I would correspond that with the county administrator and the county attorney. So those are really the big changes that are in here. One of the other changes is we have to have a way for people to report if there's any fraud, if they know of any fraud abuse that's going on. So we have to have an anonymous hotline for people to report on, and it has to be on our website or a way for people to have access to that. So we are looking to contract with a company what's called Lighthouse. They have a hotline software, I guess you would call it, where it's $1,250 a year. And they would handle that. They would set it up for us, and then those calls would come into us anonymously. So that's another piece of this compliance plan.
75% reimbursable.
That would be 100% until we meet our, depending on when we pay for it in the year. The first probably 3/4 of the year would be 100%, and then after that it would be 36%, depending on when we maximize our state aid. Yeah.
On our grant, well,
Infrastructure grant. So then it would be 100%. Yeah. Yep, depending on where we claim it. So I think does that have to be approved or, okay. So just looking for a motion to go forward with this compliance program that we have for the Office of Medicaid Inspector General.
Any discussion?
Just trying to understand if it's a policy, is there any other review necessary on it?
We would go out to you folks before you go on, so you can look at it. It's sort of,
But
unlike the other thing we were just talking about, this is required or else we can't operate. So, and it's very well dictated to us what has to be in there. So, we're just coming into compliance with the regulations, so we can do it. But since it's a policy that is front facing from the county in general, it's going to be, it's not an internal thing. The team that has to do is regulatory policy.
Any other questions? Okay, all in favor?
The next item we have, every, I believe it's 2 years, we have to reapply for our limited service laboratory operating certificate. In short, it's called an LSL. This gives us the ability to do, if necessary, have to do HIV testing, rapid testing within our office. It also gives us the ability to do blood work within our office. And it also gives them the ability to do hemoglobin tests within their office. So it is a separate operating certificate that we do have to apply for. So what I'm looking for is approval to go ahead and apply for that. And it is a $200 reapplication fee. And it is a check that would need to be cut from the treasurer's office to go ahead with this operating certificate.
Okay, very much. Right, second, any discussion? Okay, all in favor?
Okay, okay. And then I do have a couple program updates or requests for permission. We have 2 fellows that are on staff. One is a fellow, one is a graduate fellow. They are offering, the New York State Department of Health is offering a public health tour summit down in Albany from December 12th to December 13th. One of our fellows will actually be presenting at that summit. So I'm looking for permission for them to stay. And also Eliza, she's their mentor and their supervisor. The conference goes till 5 at night and then it starts again at 8 o'clock the next morning. It would be 100% covered on the grant, both the fellowship grant and the infrastructure grant. So just looking because of the time of the year for them to be able to stay for that overnight and again, it would be 100% funded.
And it's within the 60-mile radius, which is awesome. Needs community.
So moved.
Yes, seconds. Any discussion? All in favor?
Perhaps it's time to relook at that radius because I can't think of the time we haven't granted an exception. Therefore, if we're ruling by exception, maybe it's time to look at that, not necessarily in this committee, but overall for the county. Look at that policy. Like I said, I can't remember last time we said no, which is fine, I'm not, but let's change the policy.
That's actually on the radar because that was brought up a couple months ago in committee because there have been so many requests for that 60-mile radius. And they have been approved every time. Sometimes there isn't a lot of notice that the department heads are able to give for those. So I was going to bring that up again. There wasn't much interest in changing the policy when we discussed it 2 months ago. But as it occurs more and more, maybe we should do it again.
Your next policy for next month.
We didn't have a policy to talk about.
Yes, so I know I mentioned our tobacco cessation program before. One of our fellows is the one that has designed that, and she has been requested to do a poster presentation at the summit that I was just asking for permission to go to. And we'd like to be able to use the county logo on that poster presentation. So I'm just looking for permission for her to use the county logo on that poster presentation.
That's Brian Rose moves and Cassie seconds. Any questions? All in favor?
The next thing, we would like to request to spend a portion of our public health infrastructure grant on public health attire. We really don't have anything with our logo on it for our staff to wear at community events. So we have been approved in the grant to spend up to $5,000 on public health attire for our staff in order to wear out at community events and clinics and things like that. So we're just looking for permission to move forward with that.
Okay, sorry, and Jim seconds. Any discussion? Yeah.
What would you describe as the attire that you're looking to get?
We're looking for like, the collared polo shirts, with the county logo on them. And possibly sometimes we're doing things outdoor events, so we're looking for maybe like a fleece, that would have the county logo on it. Things like that.
I think that's what I heard him say.
Oh, they're just hideous, red.
Go with the white, put writing on them.
I should have done that as a Halloween costume today.
You still got time, you don't have it verbal. Anyways, all in favor? Thank you, everybody.
On to more serious subject. As you know, the RSV vaccine has been approved for older adults. We have been getting quite a few calls in our office about, people having difficulty getting that vaccine. It is for 60 and older. The issue is how it's covered. So if somebody has Medicare, it is covered if they have Part D Medicare. We are not a Part D provider, we are a Part B provider, and it is not a vaccine that's covered under Part B. So first, the person would have to have Part D coverage under Medicare. The other issue that we're finding, people are calling and saying, well, I go to the pharmacy, but I can't get it there. They're requiring a script from their doctor to be able to get it there. The other issue we're having is veterans calling, saying that they can't get it through the VA. So what we're finding there, and from the research that Eliza has done, is with the VA, you have to go to a participating VA pharmacy that participates with the VA, first of all, and then you also have to have a script from your physician to be able to get it. So there are some.
You have to call the VA and just triple check.
Right, and that is our recommendation that we give everyone, is to always call your healthcare insurance to find out what is covered and where you can go to get that. So if you are hearing that within the community, we are also getting those calls, and there are some barriers to getting that vaccine. So
So you bring up a good point. It's a question because I don't know if we cover that, but we have an elderly population anyway here. Do we have anything that lets the elderly population know that this is when you want Part D? Well, you should be, so they can weigh their own situation as to whether they should be paying for Part D or not. That's what I don't have.
Your
any-
question.
So our office has the IDF program, Health Insurance Information Company Assistance Program, and they do just that.
Perfect.
Free, non-subjective, objective, information for individuals to look at their situation and do a comparison to what's all plans.
Thank you. That's important.
And then the last thing I wanted to mention, or actually I have one more thing, sorry, flu clinic. We were able to do 85 county employees at our flu clinic here in both in our office. We did one in our office as well, so I just want to make sure you're aware of that. So that was successful. And then the other thing I just found out yesterday, Fidelis Care is doing a dental clinic in partnership with American Mobile Dental. And it's going to be at St. Anne's Institute, which is right next door to Public Health. It's actually tomorrow and Friday from 8:30 to 4:30. So it is for adults that have Fidelis, and it is by appointment. So I just want to make sure you were all aware of that in case you saw that bus sitting over there. And again, this is something that I just found out about yesterday. But I mean, definitely is a good thing. They do have appointments still available. So if there are people in your community that are in need of dental work, and they have Fidelis, again, it was kind of a last minute thing that we just found out. But they did state that if it is successful, they will be coming back on a monthly basis to do that. So hopefully it'll be, better advertised within the community for people to utilize that service. So. That's great. So that's all I have.
Any other questions? Regina? Okay. Thank you very much.
Thank you.
So there will be one more. Okay.
Like to first start and show you that we received a letter of resignation from Marianne Nichols. She has served on our OFA Advisory Council for over 10 years. And at this time is really wanting to just, is having challenges finding the time and transportation to get to the various meetings and wants to give up her at-large spot. So at this point, the terms of the advisory council members are through December of this year. So we're gonna hold off on backfilling that until we start our process in December and then look to do our appointments for 2024. I have a few items here that I'd like to share with committee. We received a letter from the New York State Office for Aging telling us that back in year 2022, Washington County distributed 1,805 senior farmers market coupons, and the coupons valued $9,025. The older adult recipients successfully redeemed 1,059 of those farmers market coupons. As a result of all the efforts, they received $5,295 in fresh local produce from our local food stands here in our community, which most certainly supports their health and nutrition. Thank you. Hopefully we'll beat those numbers for 2020. So we had a couple of large events this month. The first event was our Health and Wellness Fall Festival. So I just wanted to give you some data on that. We had approximately 184 people sign in for our event, and we served 175 takeout meals, which is pretty astronomical for us. Again, you know, Brian, you just asked about Medicare plans. This whole event is focused on that. So we had all of our Medicare providers there on site to provide information and answer questions for individuals with no pressure sales. We also had many agencies. We had public health that helped us do blood pressure checks. Sheriff's office was there to talk about scams and also speak about their Yellow Dot program. And then we also had a local pharmacy, McCann's, and they were able to administer the flu vaccine. So most certainly we were pretty pleased with the outcome of that. The other event we had was my annual public hearing. And we had 164 people sign in for that event, with 35 comment sheets provided. So at this, the reason for the public hearing is to gather information for the writing of our annual plan. And we'll certainly, you know, we ask the public to provide us feedback in many different ways. And at this event, we ask them to speak or ask about services or programs, or make comments about programs, and then also to kind of provide us with some written feedback as well. So some of the comments that we had that I just wanted to share with committees that somebody said, I consider myself very fortunate to live in Washington County. I appreciate the wonderful services and programs that are available. Great job, thank you. Somebody suggested that our office look into a computer technology loan program. We've had over the past few years a lot of interest or request to look into like handyman services. So somebody spoke about how they try to do their own plumbing, and it's challenging now that they're older. We've had a lot of people talk about snow removal, lawn maintenance services, and just completing small home repairs. So that has been on our radar over the past several years. And at one point, we did have a contract with Leaf to provide some of those services. But since that contract is terminated, we're seeing it kind of resurface the need in the community. This comment I wanted to share with everybody. The person mentioned that they don't like paying high taxes in Washington County, but that they are grateful for the services that they are offered, and that is why they choose to stay here. The person spoke about they wouldn't want to live anywhere else because they know that they have the support that they need here in the community to age within their own home. So that was the majority of the kind of summary of the public hearing event. At the event, I also handed out a needs assessment. So I brought some copies here. Oh, absolutely.
With regard to the question about lawn maintenance and snow removal, and that sort of thing, there's some way to interface with the veterans. We're just asking for volunteer things to do in Washington County. Is that a synergy we can take on there? Just seems like that.
Sure, yeah, I definitely see. So over the past several years, when we've had individuals reach out to our office and ask if we have like a list of recommendations, we really don't have a list, because we're not sure of the people that we would have on the list per se, or we wouldn't, we wouldn't want and place anybody in risk, of somebody that's probably not legit on the list. So, most certainly, there is a program in Glens Falls called Aging in Place, and they serve the Glens Falls region, which is really actually, they consider Washington County part of that. So that is, they call themselves a village, but each individual is in their own home and in their own community, and they join for a very small fee every year. Their village called Aging in Place, and they exchange volunteer services amongst each other. So for instance, if there was a plumber within this group, then that plumber would exchange volunteer services for something else that they may need, like that sort. So there is that program that is established, which is something that I did speak about at the public hearing, trying to encourage people to really join that and to be part of that giving and sharing.
Don't have to apply for release.
Correct.
Can't imagine that. How about exchange?
Public hearing, that's annually,
Correct.
and is that a normal number, 165? I mean, is that, does it always bring out a lot of people? And we've all held public hearings and we're looking to get 10 and one to speak, so is that?
Yes, so I tried to be pretty creative to gain the attention of folks. And so when I facilitate the public hearing, I advertise it, obviously, a few months in advance. But I also do it during the Council of Seniors luncheon.
Oh,
Smart. Yeah. So it's a win-win. People enjoy a great.
I just have to serve lunch tonight.
Food is always an attraction, so we'll see.
How many supervisors did you get? That usually gets them all out.
That's a great aging one.
That's probably why.
Yes.
We're gonna have. So at the public hearing, I also gave. Put this on everybody's place setting. This is a needs assessment that we're facilitating this year, and this is something that is done every 4 years, and the purpose of it being to gather information and public input from the community. So the way we conduct these assessments across the state, every county is unique in how we facilitate it. This year, I just wanted to bring it to everyone's attention that we have a link set up on our webpage where people can go in and click on the link, internet access, and then it brings them right to the needs assessment. So we collect them by paper. As I mentioned, I did conduct 2 focus groups. I conducted a focus group in Fort Ann. I had asked them to complete this. And then also at the public hearing, I asked people to also complete it as well. And so at this time, I would ask your assistance in encouraging individuals, Washington County residents age 60 and older specifically, to complete this and submit it back to our office. So that I do have it included in the minutes for today. Again, it is on our website. You can go right on our front page and click on the link and submit it electronically to us.
Right, electronic. They also.
Absolutely. Yep, by paper. If people would rather just call our office and ask the staff members to read the questions, they can fill it out for them too. So we can pretty much assist people in many different ways to gather their information. So we're hoping to gather all of the responses by the end of this calendar year. Any questions on the
But did you fill out, turn back?
I was gonna say. You
You can do the first.
need a pen, Brian and I can dig together.
Oh, okay.
We're getting closer.
So I do have a couple more items that I wanted to talk about. The next item is called the Master Plan on Aging. As you may or may not know, Governor Hochul signed an executive order asking state departments to work together to develop a master plan on aging. And this master plan, what we're being told is to lead the budget in the upcoming years. So at this time, the Department of Health and the New York State Office for Aging are both co-chairing this initiative, and below them are several subcommittees. So what the piece that I wanted to talk about today is that the master plan on aging is seeking, it says here, electronic iteration, a public survey. So they're putting out to the public a survey for the community to go in and to share their responses. So I have an email that includes the link to the survey that again will be shared in the meeting minutes. The deadline for the survey also is at the end of this calendar year, and they are offering to mail a written copy of the survey to folks upon request. So this is going to kind of tie into my next item. Again, any way that we can advertise this, you can encourage people within your own communities to fill this out. It is of great importance because again, it's really going to lead all the initiatives in the future. So it ties into the next item that I have. The New York State Office for Aging, the Association on Aging in New York, is led by the executive director, Becky Creedy. And Becky, alongside of the New York State Association of Counties, Steve Aquario, have partnered together to write a letter to the governor for the advocacy of our network. As you're all aware, the network has been faced with rising demand, rising inflation, flat budgets, and an overburden for funding from local governments. They are looking to start their budget advocacy at this time, and they're asking for our support and the support of our community-based contracted organizations. So I have the letter printed out again. I'd like to send this out to everyone via email because the deadline to sign on to this advocacy letter is Friday. So it's coming up very soon. So again, the letter, I would like to have permission to sign on to this, and then if permission is granted, to also encourage everyone here to also sign on to it. Just a few highlights of the letter. It is a pretty lengthy letter, but it's extremely data driven. It talks about how New York State ranks 4th in the nation for the age for the over 60 population. The economic, social, and intellectual contributions to our state are vast and regularly unrecognized and discounted. However, the need for life-sustaining services for older residents has and continues to far exceed the resources available to meet this need. So at this time, both associations, NISAC and Association on New York, are advocating and asking the governor to increase funding for NYSOFA to 252.5 million in the state fiscal year 2025.
What's the current one?
And I'm sorry,
What's the
I don't
current
know.
number?
I'm not sure at this time.
They're so
I know
flush
that
with
it's not
money, I'm
enough.
sure they'll, oh, yeah.
I can tell you, yes, I know that it's not enough. The letter just goes on to talk about how the services are proven to be comprehensive, person-centered, and incredibly cost-effective in delaying and preventing the spend down to Medicaid and supporting the state's longstanding goals of aging in place with dignity. The majority of the state's older adults are not on Medicaid and do not need to be on Medicaid if community supports are strengthened and expanded. And again, just emphasizing that through our office, through the New York State Office for Aging, we focus on providing community supports for non-Medicaid individuals. Again, it talks about that, you know, you cannot predict the future of Medicaid savings. However, data overwhelmingly shows that individuals can be supported in homes and communities at a fraction of the cost of an institutional setting. And looking at the New York State budget is abundantly clear that older New Yorkers are not appropriately valued, nor is the vast community network that serves them. We believe this investment will ultimately save the state far more money by preventing unnecessary placements. So again, at this time, the deadline to sign on to this letter, again, the letter is being supported by NISAC and the Association on Aging is this Friday. So at this time, I would request permission to sign on, and also if I could share it with everybody.
Does Roger have to look at it? Reason? Just asking.
I guess I'm trying to figure out why we're having this conversation. Because this area.
That motion.
Yeah, I just needed to know if it was on the list of things Roger had to check.
Yeah.
It's not, we're not meeting the county, other meeting the county. We're just expressing our opinion. That's not really the issue, that's your opinion.
9 seconds. Any other discussion? Okay, all in favor? Thank you.
Thank you very much.
The Hudson Tech Water, a newsletter, you know, it was maybe 2 days ago. And then there was a letter from, being 90 to 100 and what these patients say they want. It was exactly things that talk about staying home, less meds, and quality of life, and just being happy. And sometimes you've got to listen to what other people want. And but the letter is actually wonderful, and in there is an article about PACE, which if anyone's familiar with PACE, okay, that's an up and coming way to support families and the older population. For 3 weeks.
Gina, the survey that you're having is, we all have designees from our towns too, they're working hard on this, so that. So if we talk to our people from their town, we designate your office, they'll know what we're talking about.
In terms of the needs assessment.
Yeah.
survey, absolutely.
Okay. They should be collaborating to get this done too.
Thank you.
We have any other business? Rob, did you have anything? Tammy, did you have anything? Everybody's good? Okay. Any other business over here? No? Okay, so we're gonna go into the opioid settlement fund recommendations. Okay, we're gonna having a working committee meeting now. It's in place for the year. Okay. So now we bring it forward to you. And if you want to look at that spring with the PowerPoint discussion on what we talked about and just decided to move forward. So I'm gonna turn it over to Melissa.
So as Supervisor Larry mentioned, has been going on for probably about a year. We have met with several of the department heads to get their feedback on where they thought that the opioid funds would be best used, have the largest impact on the community. So after many discussions, and a long list of items and recommendations, we've narrowed it down to 3, which will be presented to you today. We can go to the next slide. The total amount of funds that we have received so far is $313,000. I'm sorry, $313,799. 44 cents. That's to date. So the funds have been kind of difficult to get a really good handle on, because some of the money that has come in has been anticipated, some has not been anticipated. So therefore, we have held off on really coming up with the ideas and bringing them forth to you until we really had a idea of what we had right now. We expect the upcoming funding to come in a little bit over $20,000 a year, up until the year 2038. So the recommendations that you see today, I think should probably be reviewed annually to see where the funding is, and to have some discussion on programs that you would like to consider going forward with, some that you may think are valuable enough that maybe you want to use county funding with, or some we just maybe that aren't working and we just don't go forward with. So we can go to the next one as well. So there's different uses for the funds that we receive. The restricted funds can be treatment, prevention, and then there's other strategies as well, which include first responders, leadership planning, coordination, training, research. So that's what we've used for the guidelines to come up with the recommendations. And the recommendations that will be presented today, we have the pre-arrest diversion program. The funding for that would be the $40,000 for 1 year. You have the responder health program, which is $36,000, and then the opioid response coordinator, which is $97,000, and that does include the benefits. And you'll be given more information on those 3 programs going forward. So the first one that we're going to discuss this morning is going to be the pre-arrest pilot program, otherwise known as LEAD. And Sue Mowry is going to come up and go over that affects her department. So the LEAD program is something that I think we've discussed in the past, or at least when Mike was here, he had discussed it a few different times. But this program is specifically written in as one of the approved funding into the opioid settlement funds that says it addresses the needs of criminal justice involved persons, and then it, to support pre-arrest or pre-arraignment diversion, officer prevention strategies such as law enforcement assisted diversion. So we've collaborated with the sheriff's department to kind of come up with a tentative program in which the goal would be to target individuals who could be arrested for the lowest level of drug charge, criminal possession of controlled substance 7, and or that would be our focus, but maybe on lower level possession of hyperthermic needle or something like that, to try to facilitate and get momentum moving to get those people into treatment and with some supervision in that moment. So if the person agrees to participate in the pre-arrest, so they wouldn't be arrested unless they choose not to participate, and then the normal legal process would take place. So in our version, it would be the officer that would identify somebody that would be lower level, maybe somebody who had a criminal involvement. They would refer to our agency after hours or within hours. Either way, we would have somebody on call to do some triage in the moment The officer would identify those people, they come into our office, we fast track them into treatment. And or knowing that sometimes there's a wait for treatment, we do have somebody on staff that does cognitive behavioral intervention. She does drug and alcohol evaluations. She's very in-depth, all things treatment, so she can provide that supportive person handoff until they get into treatment. And then our goal is, you can, move ahead of the slide, sorry. So this is where we're talking about the process. So in that, we would be drug testing, really focusing on family involvement to get that person, because most often we find that the families are, they've burnt some bridges. So getting that family back in, cognitive behavioral interventions, and of course, the treatment component and getting them into treatment quickly. Successful engagement would mean that that arrest does not happen. Thus, they wouldn't incur all of those criminal justice costs. And moving forward, when we're developing the policies and the handbook that goes along with this, I mean, I would like to get what kind of those costs are. What does it cost to go from, through the process? We know that just from our CAP arraignments, we know that the average pre-trial time span, I think in our county, is 69 days. Whereas the state is 110 days that somebody is like predisposition. But then you have the court dates, you have the public defender costs or the assigned counsel costs in those cases. So there is a cost to go through the juvenile system. So the successful engagement would not mean an arrest. An unsuccessful engagement, the sheriff still has the option of moving forward with that arrest. We have not worked out like what that time span is for program involvement. We are anticipating, max. We're fully staffed at alternative sentencing, but max, we're assuming that we could work with maybe 15 people as this is a pilot. So we want to be tracking. You can kind of move ahead to again. Sorry. So our target population, since we've had a few conversations in the past about this, along with the DA, the DA was clear that he didn't want us to focus on DWIs or domestic violence or sex offenses, which DWIs for opioid diversion dollars actually could be served, but we're opting not to. We're focusing on those with lower level drug charges. So some of the data measurements. So thinking about how we can measure whether this is successful as a pilot program, I think for each individual that participates in the program, we would review incarceration data to make sure that they're not incarcerated, at the 6-month mark. Were they incarcerated at a local jail? Did they have a CAP arraignment or an arraignment in the local one of the local courts? And then of course, a client survey that would indicate, did they complete treatment? If we were closing the case prior to them completing treatment, did they complete treatment? Have they remained abstinent? And then again, at the 12-month mark after they complete, just to see if this actually makes a difference and stops that progression into the justice system. So at a glance, I took some of the data from our from the court dockets, and I contacted the DA's office. So in 2022, there was 48 individuals charged with criminal possession of controlled substance 7, and 13 individuals were arraigned at the CAP court for that particular charge. And then I just took a glance at the court dockets for these dates that were on here, and that just gives you an indication of how many are on the docket that have those charges. So there's probably a need. Go ahead.
Now, my question is going to be, so let's take maybe Kingsbury and
Yep.
and maybe all those areas.
Yep.
Does that take into account the ones who were arrested at the prison?
No, well, I mean, it could be, I don't know who the specifics of these cases. So I can't even tell you, out of those 5 in Kingsbury cases, I can't tell you whether that was their first time arrest, because we can't run criminal histories on them to see if they've been arrested in the past. So I don't know the answer to that specifically. I know that on the docket, there's 5 cases in Kingsbury on the 10-4 docket.
And I only ask that because some of those experiences just coming through here, trying to smuggle into the prison. The judge has to do what he has to do, and he's probably never seen anything after that.
Correct, and that would probably be not somebody that would be targeted for this type of intervention, because they would need to be really local.
Yeah, I
Somebody
just didn't know
that
if
we
they
could
reported
work
those
with.
numbers. That was all.
Yeah, I don't know the answer to that specifically. So our requested funding is $40,000, and we're anticipating, like on-call services to subsidize the on-call services of $10,000, the program management piece, which would be the case management, and then the identification and policies and those types of things, 14 hours a week or working. So really 60 hours of staff time perhaps. Now, since this is a pilot program, we're really just guessing a little bit on how much time it will take. I'm going to have staff document the time so that we can kind of have a really good idea moving forward for next year to say, does it work, does it not? What is the cost? Is it less expensive, or what's the return on investment kind of piece? So. So this is, we're anticipating 15 clients. So if you just divide 15 by the 40, it would be a cost of $2,666. Now, we may have more than 15 cases. And those are just some of the reductions that we anticipate, that there would be a reduction in those pieces of the justice system. Go ahead.
How do you track it and see it successful?
So the success will be if they have not been. We can't track, our agency is not allowed to do criminal history, so I can't necessarily say whether they'd be rearrested. However, I'm gonna look at the court dockets to make sure that that person is not on the court docket at the 6-month mark after they complete the program, and the 12-month mark after they complete the program. We're gonna use the self-report survey. We're gonna try to get them to indicate whether they completed treatment, because we know those that complete treatment are a little bit less likely to be re-involved in the criminal justice system if they complete treatment. And then, so at the 6-month mark, the 12-month mark, we're gonna try to have measurements that will determine whether it was effective. That makes sense.
And this is all basically salary, right?
Yes,
Right.
yes.
So
Yeah.
how does
Salary
that
and
work?
on-call.
Is that gonna be like additional time, not additional employees, right?
Not additional employees. We recently became fully staffed again, so I think we can incorporate components of each person's job, or a few different people in the department would be working on this project, so to speak. So at this point in time, we're not anticipating hiring any new employee or anything like that. We're going to be incorporating it into some of the jobs that they're already doing pieces of.
Well, I guess what I'm trying to find out is, do you take into consideration the .1s, if we have this additional money funding some of the .1s, then can you reduce the budget where we're dependent to support .1s without this program? Now, this money is going in to offset some of those .1s. Does that reduce the budget, or is this just on, how can it be on top of the .1s if we're not doing any extra employees? Or I don't know, am I asking? I'm trying to make a point. I don't know. if I got it.
You're making sense, but that's gonna be on how they run the program.
It'll convert appropriate fund balance to reserve appropriate fund balance. That's all it'll do,
Right.
is shift.
Right.
It'll shift from fund balance appropriation to reserve fund balance appropriation.
Okay, I see what
The
you're
point
saying.
that they're already in the budget,
Right.
Right.
and until the appropriate fund balance is 0, that's the first offset.
Perfect. for laundering fund balance.
You're utilizing reserves of my rainy day fund.
Any other questions? Christian?
Which I am all for.
Me too.
Any other questions for Sue on this?
Thank you.
With no questions on that, next we have Tim Hardy, Deputy Director of Public Safety, who is going to present the Responder Health Program.
Anything on this matter?
I live in Lockport.
I've seen it a few times, so.
All right, good morning, everybody. And thank you for giving me the opportunity to talk here for a couple of minutes about it. This was an initiative that I've talked about in the group an awful lot. So just to highlight a little bit about our first responders here in the county. So we have approximately 600 throughout Washington County. That's all of your local fire departments, your EMS agencies, all of our law enforcement agencies, and partners with our frontline case workers. Look at things that we consider as part of that group that are dealing with the everyday stress of handling everyone's worst day. So as we encounter that, we look at the need. Right now, certainly we know that we're a community that's rich in our dedicated first responders and support personnel, and we're struggling all to recruit and retain people. And as we look at that, that certainly takes a toll on our first responders when you're handling everyone's worst day every day. So ensuring that our first responders have direct access to resources to take care of their own health and wellness is critical. So depending on your varying agencies, some of the volunteer fire and EMS agencies may have a level of EAP, a lot of them do not. That's not something they purchase into here at the county, certainly we have it as employees, but it's not specifically designated for first responders or have first responders on staff that deal with those kind of things at the EAP level. So what is responder health? And I'll read this just obviously verbatim because this comes directly from the program. Responder health is a comprehensive first responder support program that focuses on prevention, intervention, and aftercare, unlike the traditional EAP and other technological solutions that are out there that market to first responders. Responder health provides a full scope of 24/7 confidential, trauma-informed services to first responders and their families. The scope of services includes access and referral to counseling, coaching, training, and education, and culturally competent resources related to finances, fitness, marriage, parenting, and more. All of those things that make us as first responders whole to be able to help other people in their time of need. So the difference between responder health and traditional EAP. So EAP is semi-confidential counseling service and referral service that's typically offered by an employer like we do here at the county. They typically provide short-term counseling and referrals to support services like legal, financial, stress management, those kind of things. Traditional EAPs obviously are valuable. We all use them, or a lot of our employees use them, but we do have a lot that don't. Responder health is specifically designated for first responders. The people on the other end of the line when you call for assistance are first responder trained. They have at least 5 years experience and all the certifications necessary to deal with first responders in crisis. In addition to access to other levels of support, access to different programs relative to things like substance abuse, financial assistance, those kind of things, tons of different programs that we can. So what we're proposing is working together with the other leadership partners that participated in the opioid settlement funding group. We respectfully request further review of the potential implementation of the responder health program for all 600 first responders in our county who serve all of our communities. It's a lot of people, and certainly they are a valuable resource. Every time we lose a first responder, which happens every day, due either a stressful situation in their own life where they're not able to be able to help others, or when they just can't do it anymore from the things that they've seen and dealt with. So what we're looking for is a 1-year start to this program, which is a contractual program at $36,000, which will cover those 600 people. The best part of this is we get a lot of things within this, not only a 24/7 crisis helpline, training. There's a bunch of different items, but also the most important part for us to know that if this is working is an analytical piece that is confidential, doesn't release any information about any of our participants or their families who participate in the program and use the services, but does give us feedback to let us know if it's being used, how well it's being used, if it's turning out well. And certainly they follow along with the aftercare with these folks, any of our first responders or their families that reach out to them, they reach back to make sure that they're getting help they need.
Very good. Does anyone have any questions for him? Yeah, you're thinking about all of us, the fire departments and, or what some of the trauma will be seen. Especially with that. Without overdose, and I had that too. It's a difficult scenario. So it can't be good. Other place to keep our communities whole.
Your 600, Tim, is all of the firemen, EMS, and the sheriff department. It's all of them collectively, correct?
And then the final recommendation from the group, after much discussion, was the opioid response coordinator that would be implemented by the sheriff in his office. Sheriff Murphy is going to give an overview.
There's a copy.
Everybody else up here. That's a good.
Yeah, I made one copy, because I don't want to look at that.
Green light too.
I do have the PowerPoint exact. Like,
Yeah, I was gonna ask that, boss or somebody else. Statistics so that people guys don't. But I'd also like to thank the group, the working group for all the time spent meeting and coming up with these different ideas. And I'd like to thank the board for listening to our recommendations, and hopefully agreeing with the needs. This screen basically shows overdose data in 2020 and 2023. And that data basically comes from our office, and maybe some of it comes from one of the coroners. Not all the coroners report overdoses. So if they don't, we don't handle the case, for instance, if it's in a village or if the state police handle it, then we wouldn't necessarily report it. We tried to get the local police departments to do it, but we're not getting the response that we're hoping for. So, I mean, these numbers are high enough. Just if not, and the coroner, I guess. And you can see that each year, there's just way too many overdoses in general, and way too many fatal overdoses especially. We've done a lot since, some of it will be reflected in some of the future slides. We've done a lot since 2013 when we really saw this problem coming, and some of you were still on the board back then. I went to the board and said that this was a time to sound the alarm, that we can see where we're headed with the heroin at that time, the heroin epidemic that we were facing. And I appreciate the assistance where we're able to put an investigator on to handle specifically drug cases. As you know, we started the hometown versus heroin group, which is kind of more several different names since 2013. But they do a great job with educating the public. And it's made up of many different groups now, subgroups. But the epidemic is not ceased. You know, I said back then, you know, from the sheriff's office perspective, we can't arrest our way out of this. We have to be more creative about how we can help with this epidemic. So, as you can see, in 2022, we had the second box down there on the left. We started on naloxone distribution and administration and really tracking it. We started, we're kind of the first in the area that have the lead behind kits, which is where if we respond to an overdose, we actually leave naloxone behind, have train the family members on how to use it. Do a lot of community outreach events, as you can see, 83 of those. And then the number of kits that we've given out. And we also do a lot in the jail with the inmates. We also train them to how to use the kits before they're released. And then the bottom box just compares 2023 to 2022. And this all right now, presently, is being done mostly by a lieutenant that we have that is our Office of Professional Standards. Lieutenant has a lot of different duties, a lot of other duties that relate to use of force reporting, training, setting up all the training, documenting all the training, doing all the things that we need to do to stay, you know, efficient and keep sufficient records, which is a cumbersome job in and of itself. Still able to do all these things related to the opioid epidemic that we're having. So in conjunction with this, with the plan that we would like to put in place is a peer support program within the office. And there's no way with the amount of workload that lieutenant is doing currently related to the opioid issues, that they would be able to do this as well. So what we're looking for, and the best part about this is we have people that are fully trained as peer counselors and crisis counselors. So it's not like we're starting a new program that from scratch that we have to try and invent. This has been something that has been going on for years within the office. We're up to 5. Like I said, they have different levels. We have one that has the highest level. And he does a lot of crisis intervention, crisis debriefing, stress debriefing after critical incidents that occur throughout the county, which unfortunately are on the rise. And I've been keeping the board updated on the numbers of calls for service and how they've been going up steadily. I recently took a look at the calls for service by week, which is something I really haven't looked at in a while. We usually just break them down annually or monthly or whatever. And there are 300 to 400 calls for service for 7-day periods. So 300 to 400 calls for service per week since August, which since I've been a sheriff, that's just, that's a huge number. And not only have the calls for service increased, but the types of calls for service are more dangerous calls. They involve weapons, they involve deaths, they involve serious physical injury, fatality accidents, those kinds of things. And it certainly takes a toll on, to Tim's point, not only the deputies, investigators, and everyone that responds, but also fire and EMS. So this peer support program would include and work hand in hand with Tim's suggested use, which would be, but it would be an actual person and one of these 5 people that are trained. So the next box breaks down how many sessions of incidents we did in 22, and that's with our peer counselors, those 5 peer counselors. And then a number of just sheriff's office members that have reached out for assistance after one of these traumatic events, which is 31. And then the number of external agencies, which would be fire and EMS, which is 55. And then the bottom box is for 2023. But I can tell you that, you know, from firsthand, participating in these events are extremely important. And I think making an investment on our county employees and on the fire and EMS personnel that respond to these type of events, including opiate related overdoses, which, as you can see on the previous pages, we have way too many of those. And that also adds to the toll that it takes on deputies, especially when you look at, you know, just my office and you look at the changes that we have in staffing. Our department is very young and we have numerous deputies that are in their 20s, for instance. And it might be the first time that they've encountered an overdose or someone that's died from an overdose in front of them, and they've tried to use naloxone, and the person expires anyways. That's a traumatic event for everyone involved. And then if you multiply that times the number of cases and incidents that they respond to on an annual basis, you can see that, I hope you can see that there certainly is a need for an outlet for that. So our suggestion is that we move a sergeant who is the one that has the most certification, the highest level of certification. He's been doing this since I've been a sheriff. He's been doing it and he's outstanding at it. Goes to schools and does the prom crash drills. He does this oftentimes on his own and doesn't even tell us. We've had incidents within the office where there's been a serious incident and we find out afterwards that he literally moves in with the person and stays with them and helps them through that time period. And then never tells us about it. We don't even know it. He doesn't put in for overtime. He just does it on his own. He's pretty much recognized statewide, but with his abilities to be able to perform these critical stress debriefings. I've attended them myself, so I can personally attest to the fact that he's very good at what he does. And he's very good at talking to our members as well as fire and EMS, and he's requested often by surrounding counties to go to their counties and do the same thing. So basically, it would be moving him in, and then he would assume a lot of those duties that I was talking about that the lieutenant is trying to do, doubled with all the things that that she's currently doing. So that would include backfilling his position and a deputy sheriff. So the total cost with benefits would be $97,000. The next page. Sorry. The next page. This just kind of breaks down what our office has been involved in related to opioid challenges that we face, the different accomplishments that we've made, actually, the different programs that we've instituted since 2014. And I won't go through each one of them, but you can see that I kind of already talked about the investigator and the lockdown administration. And in 2018, we implemented use of a national overdose tracking program. And we've continually enhanced our partnership with other agencies, county entities to improve the statistical tracking. I think that's very important that we know, you know, where this is headed and if we're making a difference or not. I can't imagine where we'd be if we didn't start this kind of stuff in 2013. And we worked with real property, created a public dashboard. And I brought that before the committee before, so I'm sure you're familiar with that. 2022, we gamers pilot partnership. We worked with Rob here today, pretty closely with Rob on different things related to mental health, substance abuse, and overdoses. And then 2022, our opioid prevention program was registered. We do a lot of community awareness stuff. Like I said, the Leave Behind the Naloxone kits were kind of innovative. We collaborated with public health, different harm reduction efforts. And then in 2023, which is on the next page, actually, 2023, this year, we're actually recognized by our opioid efforts in the national, with national recognition. So that kind of speaks to the success of our program, and I know it'll only be better if we're able to have someone who actually serves as a coordinator of all these different things that we're trying to do, and then in addition, is able to focus on the health of our employees and kind of have a finger on the pulse of our office, so that we know that we're providing the services to these young deputies and veterans within the office that are responding to these types of calls. So the local tracking, it's a breakdown of the number of overdoses and then the fatality overdoses. So the coordinator duties were on the next page. And they, again, they would be to continue all the stuff I've already talked about, the community awareness, continued harm reduction strategies, the referrals and submissions to mental health and substance use, and to keep our collaborative efforts ongoing. And then the right side speaks more to the officer wellness program, and then we'll be able to implement the diversion program with soon, and that would be part of this this position as well, to oversee that side of it and track that. And I just have to say that's something that Susan predecessor, Mike and I, we've tried to do this for years. I think this is the best plan, would be the pre-arrest part that Sue talked about, because if it's post-arrest, then we have to have you know, the judges, the district attorney, the public defender, everyone else involved. If it's pre-arrest, we don't have to do any of that. And to your question, Dan, we would know whether it's working internally with our records, because although we wouldn't arrest someone, we would still create an incident. So we would have that person in our own database. If they were to get in trouble in another county, we might not be able to know that. But if it's a local resident, and then they get in trouble in any village or town or state police even or whatever in the county, we would know that. So we'd be able to tell if the person was playing along that. And then also the associated duties would be developing agency training policies. So, and then we focus on the substance abuse and training agency members in the use of naloxone and trainer, which are currently the things that, like I said, the lieutenant has listed this many things of doing in addition to all this stuff. So we basically, what we're trying to do is combine these two duties together. Both of them fall under the scope of uses that are allowed for this fund. So I'll take any questions if anyone has.
Right.
So, Sheriff, this person, you're gonna backfill that position if this person gets moved to that, so this is gonna be another position.
Yes, basically we'd be moving a current patrol sergeant out of patrol into administration, so we would have to fill the patrol sergeant. So that cost is included in this. And then, so we'd be promoting a deputy to sergeant, so then we'd have to hire a new deputy. So we'd be adding one deputy to staff, basically, and one sergeant.
Okay. And so if this all works the way we're trying to get, or you're trying to get here with this person, it's gonna be funded for a couple of years, but once we're down to 20,000 a year, this will become a county expense.
Right.
I just want to make sure everybody understands what we're saying.
Yes. We certainly would, you know, with everything we do, we would track our use of this position, and I think it would be able to show the need for them.
I guess we're kind of hoping that years ahead, there isn't a need for this position, right? Maybe that's too hopeful, but.
Yeah, I think so. Like your attitude, well,
She's usually better.
You know, I also I look at the, how this, we remember this as we're older. When you had a prom and, you know, people would go out and drink and drive and get killed in car accidents. And then there was education law where they volunteered the schools who did, don't drive drunk programs and educating people, letting people know and give them awareness. This is, this, that, don't start this practice. Things have gotten better in that regard. Hopefully this also is wellness for everybody involved. I gotta give the sheriff an awful lot of credit. He's been very, very hard at this. The whole working committee has. And some of the things that we talked about have already been initiated into departments to, you know, and put into practice. So, Sarah, thank you very much. I think you have worked very, very, very hard. You've done a great job. So, any other questions for the sheriff?
Thank you.
Um,
So, as you noted, 2 out of the 3 recommendations that were presented to you today, were in support of those in Washington County that already respond to or have some kind of interaction with the people living crisis. And that is the result of the work group meeting, and realizing that in order for the individuals that respond to those crises to be at their best and to be there when people in need them, we need to give them the resources to make them the best that they can be and be healthy. So that's how we came up with the recommendations that came to today. The committee approves of these recommendations. I would ask that they would go to the next.
Yes, it's. Any other discussion? All in favor? Thank you very much. Thank you, everybody. Any other business? Okay, we're adjourned. Thank you very much.